Morgan wants to talk to a doctor about feeling depressed. He and his girlfriend have been arguing a lot lately, and the stress of their relationship has been affecting him. Morgan is in the pre-contemplation stage. Pre-contemplation is not intending to take action in the foreseeable future or not in the next 6 months. Morgan is underinformed about the consequences of his drug use and does not see a need to change his behavior.
Hi Morgan, I'm Kara. I'll be your nurse today.
Hi, nice to meet you.
Before we get started, can I ask what brings you in?
I'm here because my parents noticed my mood was different last time I was home for break. They keep telling me I should talk to someone.
Okay. Well, I'm sure it was difficult to make this appointment, but maybe I can help. What changes do you think your parents have noticed?
I guess my mom and my girlfriend both say I've been irritable lately, and they also think that I've been sleeping more than usual.
Okay. Well, from my understanding, your family is really concerned about your behavior. Have you noticed anything different yourself?
Really, the only thing that I've noticed is that the only time I have an appetite is when I smoke.
Well, change in appetite is common among people who are under high stress. You said that you smoke. Do you mind if I do a quick assessment of your habits?
That's fine.
In the past year, have you had 4 or more alcoholic drinks in a day?
No, I don't really like drinking.
Okay. And do you use any more, or do you use any sort of tobacco?
No, I tried chewing once a few years ago, and I didn't really like it.
Well, I appreciate your honesty. In the past year, have you used marijuana, street drugs, or other prescription drugs?
I smoke a little weed every now and then. It helps me with my stress.
How often do you smoke marijuana?
A few times a week since school started, but lately I've been smoking about a bowl a day because I've been fighting a lot with my girlfriend.
Okay, so what I'm hearing is that you use marijuana as a de-stressor. Are you aware that any recreational drug use can put you at risk for health problems?
I came in to talk how I've been feeling. What does a little weed have to do with this?
I know it's difficult to talk about, but with your everyday use, I'm concerned that if you continue smoking, your stress could actually worsen. Marijuana also puts you at risk for lung and mouth cancer.
Yeah, I've heard that before, but I don't really think it applies to me.
Well, that's all right. There are also other consequences. For instance, can we continue to talk about how your drug use is affecting the relationships with the people around you?
Sure. My girlfriend hates that I smoke, and we argue a lot about it. But all my friends smoke, so I don't really see what the big deal is.
Well, that makes sense. Sometimes people smoke and drive, and that can be risky. I'm wondering if you do anything like that.
Yes, I do drive when I'm stoned. I really think it makes me drive better, actually.
So if I'm understanding you correctly, you think that you drive better under the influence of marijuana?
Yeah, since I'm relaxed, I don't really have road rage. But it makes my girlfriend mad because she thinks it's unsafe.
Right. Well, by driving high, you are putting yourself and others at risk of injury. Let's talk about your relationship with your girlfriend. What do you think makes her dislike your marijuana use?
Well, beyond me driving while I'm high, she's also bothered that I hang out with my friends before her. When I do see her, most of the time it's after I've smoked. She thinks that it makes me lazy and that I just don't want to do anything fun. Also, she claims that I don't care about how she feels, but that's just not true. It's not that I don't care about her, but lately she hasn't been my first priority because I have a lot going on.
It must be hard dealing with all of this, and it seems like you really care about your girlfriend. But your marijuana use seems to be causing issues with your relationship.
Yeah, I guess so.
Allow me to offer some advice.
Sure.
I think I'd like you to consider cutting down your drug use.
I guess I should. I just don't know how else to treat my stress.
If I'm understanding correctly, you're unsure what steps to take in order to deal with your stress. I know you didn't come here to talk about your marijuana use, so I think it's great that you're willing to work with me. Maybe let's talk about some of the pros of your using.
Well, I have to say it helps me with my stress.
Okay.
Before I smoke, I feel worried about school and grades with my girlfriend. But afterwards, I feel like all my worries are gone and I'm relaxed.
So if I understand correctly, you feel like the marijuana helps you cope with the stress of your daily life.
I guess so. I like hanging out with my friends that smoke too. If I didn't smoke with them, I don't think I would fit in with them.
And to quit smoking seems nearly impossible because you spend so much time with others who smoke.
Right, I like to do other things with my friends too, like play basketball. If I changed my smoking habits, I'm not sure that they would still hang out with me.
So what I'm hearing is that smoking with your friends is fun, but you're afraid you'll lose their friendship if you change your drug habits.
Pretty much. I haven't made many friends in college, so I can't afford to lose the ones that I do have.
Okay. Well, it takes courage to realize your current situation. You mentioned you like playing basketball with your friends. Since you're stressed out a lot, exercise can be a good alternative to marijuana in helping you relieve your stress. And you could also meet new friends at the gym.
Yeah, I guess that's true. I didn't really think of it that way. But how am I supposed to balance making new friends, classes, and spending time with my girlfriend?
So you feel overwhelmed with your responsibilities and you can't figure out how to prioritize them, basically. Well, college can be a really big transition, and I can see how you'd be easily stressed out. Maybe we'll talk about some cons of using.
Well, I guess I don't like how much it costs and the issues it causes with my girlfriend. She complains that we don't go on many dates, but I just don't really have the money for that.
In other words, if you stopped smoking, you would have more money to spend on your girlfriend.
Right. I could take her out to dinner once in a while. I guess other cons of using are the health issues you talked about earlier. I don't want to end up with cancer just because I smoked weed in college.
Right. Well, you probably didn't want to talk about the cons of your using, but I'm glad you're willing to talk about them with me.
You're making me realize that if I stop smoking, I will lower my risk of having health problems later in life.
Well, good. It shows strength that you're willing to face such difficult problems. On the following scale, which point do you think best reflects how ready you are right now to change your use of marijuana?
I'd say about 4.
Okay, so by rating yourself as a 4, you're thinking about changing. Why didn't you rate yourself lower?
Well, I guess I can see my smoking as a problem. I'm more willing to think of different ways to deal with my stress.
Well, I've expressed concern with your drug use, but whether or not you cut back on using the marijuana is up to you. Let's work on developing some SMART goals for the future. These will be small, attainable steps that will help you transition from talk to action.
That sounds good to me. Maybe making goals will help me change bad habits and stresses in my life.
Let's make sure they're specific, measurable, attainable, realistic, and time limited.
Okay. How about if I only smoke 2 times a week until our next visit?
Great. I think that's a great goal. Another could be making an effort to exercise more.
I could do that. I'll attempt to work out after my 10 o'clock class on Tuesdays and Thursdays, which would lower my urge to smoke.
So what I'm hearing is instead of smoking, you'll try channeling your stress into your exercise.
That's correct. I could also do something about driving while high.
Well, a realistic SMART goal would be maybe to refrain from driving under the influence.
I could try that, but I'm still unsure.
Great. Well, your cooperation has made this easy for both of us. Making these SMART goals takes a lot of determination, and it shows that you're you're open to making progress. When we started this appointment, you didn't see a need to change your behavior, and after discussing your level of risk, the health problems associated with smoking, and the reasons why you smoke, we narrowed down the things that might be triggering your stress. We can work on eliminating those triggers as we move forward. I'm excited to talk about your progress in our next appointment.
Thanks for your help today. I'm aware of the risks that smoking causes, but am not entirely ready to quit yet. I think these goals will help me in the future.
After discussing the pros and cons of his behavior with the nurse, Morgan has entered the contemplation stage. Contemplation means that the patient may be aware of health risks, but is ambivalent about change. Morgan understands that there are many health risks related to his excessive marijuana usage, and has developed SMART goals, but is still apprehensive toward a full commitment of change.